Hello, I'm Dr. Hari Kishan, consultant physician from Yashoda Hospital, Somajiguda. It's time we are entering a winter, and we know that during winters, people are more of respiratory issues, be it fever with cough, some throat pain, cold, etc. And often, when you call your friend who has not turned up to the office that day, when you call up, your friend might just say, I'm down with flu. Flu is a general term used to when a person has some throat pain, cough, cold and fever. And this flu is usually caused by viral infection. Sometimes some bacterial infections also cause flu symptoms. Sometimes even allergy, exposure to some dust or allergen can result in flu-like symptoms. So people who are known to have allergies, like people with asthma, people with skin allergies, people with dust allergy, it's best that they avoid exposure to cold wind or exposure to dust. And so when they go out early in the morning, it's good to carry some warm wear a mask, etc. So the simple thing which is cheap and effective is wearing a mask, but wearing a mask throughout, I'm sure nobody is comfortable wearing a mask, but at least always have a mask with you when you are getting into an area with large crowds, or when somebody in your vicinity is coughing or sneezing, then you just wear mask for that brief period. Those are very simple measures which will prevent airborne infection. Some of the common viral infections that cause flu-like infections, respiratory tract infections are influenza, COVID, respiratory syncytial virus, adenovirus, etc. One of the commonest among adults is influenza virus, and we have an effective vaccine which has been around for more than a decade. It's a safe vaccine, not very expensive, and it's reasonably effective. So who can take this vaccine? Anybody who is like every adult, irrespective of whether they have some medical condition or not, can take this vaccine. But people who will benefit more are the ones who are elderly, people who are above 50-60 years age group, people who have diabetes, chronic kidney disease, people who have previous lung conditions like asthma, COPD, or chronic kidney disease, heart diseases. They are the ones, if they develop even a simple influenza infection, they tend to do worse. So they are the ones who will benefit more. If you have any of these conditions, even if you are pregnant, always it's a good idea to take this flu vaccine. It's called influenza vaccine. Various companies produce this vaccine in our country. So do discuss with your doctor if you are pregnant, if you are above age of 50, you have other medical conditions like diabetes, lung condition, kidney condition or heart condition about this vaccine, and then consider taking this vaccine. And simple vaccination can help you in a long way. It prevents from hospitalizations because of these viral infections. Like pneumococcal vaccines, not everybody needs this pneumococcal vaccination, but winter we know that pneumonia incidence rises. So if you have any of the conditions I've just mentioned before, underlying diabetes, blood pressure, chronic kidney condition, or underlying lung condition, etc., or if you're on steroids or other immune suppressing agents, do discuss with your doctor about pneumococcal vaccination and then take the vaccine. Vaccines among adults, they're not very popular in our country. Children, almost 99% of our children get vaccinated. It's a huge success. Everybody is aware of childhood vaccination, but fact that there are vaccines available for adults, and adults also do need vaccines, that is not known to many. So there are vaccines for adults which are very beneficial, effective and safe. So do discuss with your doctor whenever you go for some issue about vaccination. Thank you.
Like, comment, and subscribe for more health updates.